Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Hi, everyone, and welcome to the Dr. R Show. Today, we're going to be talking about cutting-edge stuff. We're going to talk about circumcision, a topic on the tip of every guy's mind. And if time allows, we'll go further upstream and talk about big prostates, where size really does matter. Circumcision is a very interesting and controversial topic. It has been around a long time and is at least as old as Abraham and his covenant with God over 5,000 years ago. To help explore this topic, we have with us today Dr. Geoffrey Nuss. Dr. Nuss is a urologist with the Urology Associates of North Texas and specializes in reconstructive urology. Dr. Nuss, what is reconstructive urology? Is it the equivalent of plastic surgery on the genitals? And how does it relate to circumcision?
So reconstructive urology is not exactly the same as plastic surgery, although we do use some of the same techniques, such as skin grafting and things like that. But mainly, my focus is to reconstruct the actual urinary tract, which is inside, so it's a little bit different. It wouldn't be actually cosmetic, but functional. It would be more important for the urinary function.
So that is a very special subspecialty of urology. As I understand, there's only 2 surgeons in the Dallas-Fort Worth area that do this, and you're one of them.
Yes, sir. There are only, to my knowledge, in the Dallas-Fort Worth area, there are only 2 fellowship-trained urologists in this specific subspecialty.
Yeah. Now, getting back to circumcision, what is circumcision?
Circumcision, like you said, has been around for a long time, ever since the ancient times, and it is the removal of a man's foreskin. There's a redundant portion of skin that covers the glands or the tip of the penis, and circumcision is removal of that to uncover the glands.
Now, why do we want to remove it? What function does the foreskin play?
Mainly protecting the glands from the outside environment, but really we don't have it doesn't have a major function in today. Why remove it? That's a good question. Many people will remove it for religious reasons. Other reasons would be for health-related reasons. The American Academy of Pediatrics recommends circumcision to prevent urinary tract infections, penile cancer, and to prevent AIDS or HIV transmission. But that's in very young boys, less than 6 months. Adult circumcision is much different.
Now, does the foreskin enhance sensation or diminish sensation?
That's a great question. I have many men come to me asking, well, should I get circumcised or not? Because I'm really interested in having an improved sexual experience. And what I tell men is that what you have is what you should have for your life. Because changing your foreskin or altering it in any way will likely not provide any benefit. And in fact, some men will complain that it's different and they don't like it. So I don't recommend circumcision for enhancing sexual performance or sensation.
Now, do men often come to you to get circumcised just for the cosmetic appearance?
Well, as I said, I don't routinely do that. I actually recommend against that. But when men do come to me for circumcision, it's mainly for a condition called phimosis, which is a tightening of the foreskin, preventing the glands from coming out, which can cause infection, and it can also cause painful erections and painful urination.
So men that have phimosis have had it for a long time, many years. Yeah. Why do they delay getting treated?
I think most men, as we're very sensitive, that's a very sensitive topic, and many men just don't seek treatment because they're either embarrassed, scared, or they're just plain not interested. But I think for the most part, men should seek out, if they're having problems, painful erections or irritation in their penis and they're not circumcised, they should seek consultation with a urologist.
Now, how was circumcision performed?
Circumcision is performed in the operating room. And let me take a step back. In the pediatric population, it can be performed in the office. As long as kids are less than 6 months, they don't have the sensation developed to have a painful experience. But in adults, it needs to be performed in the OR with a urologic professional, and basically incise the inner part and the outer part and remove it, and then reconnect the skin, the shaft skin, to the tip of the penis or the glands.
Now, in children, is it performed routinely still? Because the indications over the years, if you look back at the history of circumcisions, have gone all over the place.
That's a great question. So the answer is yes and no. The American Academy of Pediatrics recommends that it has numerous health benefits, as we mentioned before, but it's very clear that the decision should be left up to the mother and the father of the child. And so that is a personal decision, and everybody recognizes there are reasons for and against it, and so it would be something that both the mother and the father should have a conversation about and decide together.
And what is the current trend in regards to circumcision?
The current trend is to circumcise most men still in America. However, there are many people who are advocating against it for a lot of different reasons. Some, for the most part, most people who advocate against it feel that it alters the man in some way and may somewhere down the line predispose them to having some, what do we want to say, sexual encounter that's not as satisfying, or it somehow diminishes their experience.
And what's the potential complication of having a circumcision?
Potential complications would be shortening of the foreskin and just an altered cosmetic appearance as an adult. As a kid, you obviously will not know that what's the difference was as you grow up with it. But for the most part in kids, the potential complication would be shortening of the foreskin, which is really rare.
Any problems with infection or bleeding or anything like that after surgery?
Very rare, but can happen, as with any surgery.
When we come back, we'll talk with Dr. Nuss about BPH. What is BPH and what you should know about it. Stay right there.